Frauke Stock from UBA. I beg your pardon. Thresholds for endocrine disruptors and related uncertainties, summary of a JRC report. So, over to you.
Yes, thank you, Mr. Chairman. Actually, it doesn't matter which report we discuss first, because I think that the aspects which are discussed in both groups are very similar. Yes, as you said, now we're switching to the science, and it's a really hard task to do that within 50 minutes, but I will do my best. You may see that the title of this slide is a little bit different to the title in the agenda, which is obvious because it is a JRC report we are talking about, but the report captures the view of an expert advisory group, and I will come back to that later, which group that was. And I was a member of that group, and also was a member of the smaller preparing group who did all the preparatory work for that discussion. So as soon as I know how to do this, yep, okay. I will go briefly in the scope of the group, what was it meant to do, the topics the group discussed, the main results, and the conclusion. You will see quite a lot of text in the slides. That's because I really wanted to stick as much as possible to the wording of the report, because I think that JRC did a very good work in capturing the view of the different experts in that group. So the scope of the group, as I said, it was an ad hoc group. Well, actually, it was a subgroup of an ad hoc group of the Commission service and the member states and the EU agencies. And the idea of the ad hoc group was really to support the Commission by further developing the community strategy on endocrine disruptors. And one aspect as well was to provide help or to support the Commission with regard to the question whether or not there should be about the authorization route for endocrine disruptors under REACH. Yes, so it's also an ED expert group. Somehow it's not the ED expert group of ECHA, but it was an ad hoc group by the Commission. But still, as you can see, the second bullet point, it was an expert group where toxicologists and ecotoxicologists were present with regulatory and also, of course, endocrinology background, and they were nominated by the member states, industry, and NGOs. And the main role really was to provide detailed reflection on scientific issues relevant to the identification and the assessment of endocrine disrupting substances. And it was not specific to any regulatory framework. It was really about REACH, pesticides, biocides, and so on. And what I'm really talking about right now are the results of a 2-day session that this group had about the question of thresholds for endocrine disruptors. So what were the topics of that meeting? The question really to the group was whether or not a threshold for endocrine disruptors exists and can be established with high certainty, let's say. And that's also the structure of the report as well as of my talk, that we had two different discussions. Because if you start to discuss about the scientific issues, the first question really is, what is a threshold and how can you determine it? I will not go into that in too much detail, but because of these difficulties, the aim was first to discuss the mechanistic reasons for threshold or non-threshold. So really digging into the mechanistic questions. And with regard to that question, some other issues raised like critical windows of exposure. How does that support a threshold or non-threshold approach? Low dose effects, non-monotonic dose responses, and limitations of experimental approaches. And you heard some of these keywords, let's say, earlier on, because those are really the aspects which are discussed in the scientific world, which were discussed in the SVHC dossiers, which were discussed in other groups like the CTEC-Pelson group. It's always the same, I would say. So that was really about the mechanistic basis. Is there theoretically a possibility to determine a threshold? And then the second aspect, which is as important as the first one, about the uncertainties. And you heard that from the Commission communication. These are the two questions really which are really relevant. Is there a theoretical reason for a threshold or non-threshold? And can we determine such a threshold with acceptable certainty? And the impact of pictures was also discussed. So these are the expert views, and so these are really expert views because in most of the aspects there was disagreement, let's say, within that group. And I will try to go through that. Well, at least there was some agreement. The agreement was really that, well, if you look really into the mechanistic, the principles of receptor binding, and it needs some kind of receptor, well, yes. So at the end, one molecule could activate a receptor if the background level of endogenous hormones is high, and so the one molecule really makes the difference, which means that the receptor, at the end, one molecule could activate a receptor, and that was agreed. But so it could be considered that there's no threshold at this level, at the receptor binding level. However, and that's the next point, there was a diverging view whether or not this really results in adversity, and that's what we are talking about during regulation. Is the can a threshold for the adverse effect be determined? And with that regard to that, there were some diverging views. Most of the experts thought that a threshold of adversity is likely to exist, so that there can be something like that we can derive a threshold, while some experts thought that especially for a very sensitive window during development, such threshold cannot be derived. So at the end, at that stage, because most of the experts considered that theoretically a threshold can be derived, the discussion really focused on the uncertainties, and that's the first aspect which was already at that point discussed, that several experts were of the opinion that although a threshold may exist, it might be difficult to estimate with any confidence the biological threshold of adversity based on the current available standard tests. So that's where we are at the moment on the scientific issue, really. First, the discussion about the theory and the mechanistic basis, and the second part, which is the more important part from my point of view, about the uncertainties. I say more important part from my point of view because my feeling is that the discussion really focused on that question. So there were several aspects which were discussed. First of all, whether or not they might influence the theoretical threshold, whether or not there is a threshold, and second, whether or not they influence the uncertainty or certainty of deriving a threshold. And one aspect is the critical window of exposure, because it is very clear for endocrine disruptors that during the very sensitive life stages, that they act during very sensitive life stages, and it's very critical to expose those critical windows in order to see the effect at the end. So there was agreement that this is the effect. And also there was a general agreement that this implies that it might be very difficult to determine a threshold with sufficient confidence, which means that at least you need to be sure which is the critical window of exposure, and you need to be sure that you did expose that window of exposure. There was a disagreement actually with regard to the question whether that this implies that no threshold exists. So again, some people thought it's because of this adds to the uncertainties, and some people thought that this may mean that there's no threshold, no theoretical threshold. Next aspect, low-dose effects, something which is discussed in the science, very controversial. Whether or not low-dose effects occur, which means that you see effects at lower doses than those exposed in the test. And this discussion really is about whether or not you miss some effects if you don't test those doses. And as I said, it's really controversial. So it was in this group, as in many other groups, there was no consensus on the evidence of such low-dose effects. But actually, when we further discussed, it became evident that if such low-dose may exist, and people did not agree on that, if that would be, then the implications for the assessment would be very high, because if those low dose exist, then it would be very difficult to determine a threshold with sufficient certainty. The same actually applies to the non-monotonic dose responses. Again, this is a very controversial issue. And again, there was no consensus if these non-monotonic dose responses are something which we need to deal with regard to endocrine disruptors, or if they don't matter. So no consensus about that, but again, the group agreed that if they exist, if endocrine disruptors do show non-monotonic dose response curves, the implication for the derivation of a threshold would be very high. So then we come to the limitations of experimental approaches. And here we had kind of different opinions. And actually, I think this is very similar also to other reports, that some experts think that the current tests may not cover sensitive endpoints and uncertainties might be higher compared to other modes of actions. And here, another view comes into the picture. We all know that risk assessment is connected with uncertainties. That's true for all substances. We do have uncertainties for the endocrine disruptors, and there are diverging views whether or not these uncertainties are higher for endocrine disruptors than for other substances. Everyone seems to agree that there are uncertainties. Yes, and whilst, and that's the second bullet point on that slide, where experts seem to disagree is whether or not this means that we can't derive a threshold with sufficient certainty, or whether that means that it's just normal uncertainty which you need to consider in the risk assessment approach. So really, everyone agrees that there are uncertainties, but the conclusion from this is very different. And that's also true for all the other aspects I showed you earlier on. Among the science, there are diverging views on really key scientific issues. And I think that holds truly for many other discussions. And the conclusion out of that differs. And that's where experts do not agree, that whether or not this means that you cannot derive a threshold or not. And that's, as I said at the second bullet point, there are different opinions on whether or not it would be feasible to overcome the limitations in the near future, which is another aspect, which means that if we have uncertainties right now, can we overcome these limitations by testing more, by developing further tests, and so on. And again, people disagreed. With regard to mixtures, people were kind of agreeing that that is a matter, because endocrine disruptors can act together in an additive manner. This is not specific to EDs, it's just something which is very established for the environment, that substances can act as mixtures. And it was agreed that estimation of experimental thresholds is challenging in the case of mixed exposure, something we normally don't test in the tests. Yes. And now I come to the overall uncertainties, which was discussed quite a lot. This was a session where actually uncertainties were highlighted by some experts. So it was really like raising your point. And these were the different aspects which were mentioned by some or several experts. And again, this is the key, which was discussed everywhere, also in the SVHC dossiers. And they said the different aspects, like that the different binding to the receptors on the mechanistic basis may result in very different effects at different dose levels, depending on the life stage, on the species tested, on the conditions, and so on. The effects may differ depending on the environment conditions, like if you some species in the environment are sensitive to, like, let's say, temperature. How does that influence the result of the tests? We have discussed uncertainties related to inter- and intraspecies extrapolation, because that one is one aspect which is discussed quite a lot, whether or not you can extrapolate from the standard test to to other species in the environment, because at the end, the aim is to protect the environment, which means all species, all ecosystems, and whether or not it is feasible with regard to the endocrine disruptors, based on the tests we have currently available. I mentioned this exposure during sensitive windows and the late effects which may occur, and the limitation of the method's sensitivity and the possible lack of sensitive endpoints, also the aspect discussed. There was agreement, as I've already said, there are many uncertainties in carrying out a risk assessment. Many are not specific to EDs, but some factors may be particularly relevant to some EDs, and that was an agreement. There were different views whether or not these uncertainties are higher for EDs, whether or not they're specific for EDs, and so on. So, yes, again, the conclusion from these different views and these different uncertainties was different. So, in summary, most experts agreed that it is likely that from a mechanistic point of view, a threshold exists, but it might be very low. There were several reasons mentioned, discussed, which might make it difficult to derive such a threshold, and these are again the two levels, the mechanistic basis and the uncertainties. And I say uncertainties really with regard to the question whether or not we can derive a threshold with adequate certainty. And these aspects I already mentioned, it's the low dose effects, non-monetary dose effects, and everyone agreed, as I said, that if they exist, they would make it difficult. Mixture toxicity was mentioned, which would make it difficult. The sensitivity differences with regard to different receptors, individual species, and so on may make it difficult to derive such a threshold. And that's actually what I tried to mention as well, that there are different views how relevant these uncertainties are and whether or not it would be feasible to overcome the limitations in the future in a way that the uncertainties discussed would be appropriately addressed. And I think this really very much gives a picture of where the scientific discussion is at the moment. We have several very key aspects, key scientific issues which are discussed controversially, where experts disagree with regard to the key issues. But my feeling is that the main difference is really with regard to the conclusion based on these uncertainties in these discussions, whether or not you think that these conclusions, these uncertainties make it impossible to derive a threshold, or whether you think that the uncertainties are not as high that you can derive a threshold. And that's actually the conclusion, which is really a citation of the report. The EDEAG was asked to consider the key aspects related to the appropriateness of following either a threshold or a non-threshold approach in the evaluation of EDs. That was the issue the group should answer. As we reflect in this presentation, there were both points of agreement as well as diverging views between the members of the group on key scientific issues, and therefore there was no consensus whether or not which approach should be followed. Thank you.